Sickle cell disease is a neglected disease, but unfortunately it takes away many of our children. They die as malaria and it's not malaria. They die as pneumonia and it's not pneumonia. They get strokes. They also die by depression. Nationally, we don't have the guidelines how to manage these patients. If you're in Kisumu, you'll be managed the Kisumu way. Ukiwa Mombasa, they will manage you like the way the people in Mombasa manage you. But ideally, there must be national guidelines to manage a condition that is chronic, like cancer. There are guidelines. Whereas it's a blood disorder that you have anemia because you break down your red blood cells and you inherit it from your parents, but it can manifest in many ways. There are patients who are told you have sickle cell anemia the day they get pregnant because they just went for a normal checkup because they are expecting. And they are told you have sickle cell anemia. There are kids who wake up and they're suddenly blind. One eye is not working. And then they go and they check them up and there's really nothing. And they say, let's do a blood test, and they find there's sickle cell anemia. So, and that's why it's so important that in this country, we think very quickly of a way of telling our mothers and our fathers that your child does not have sickle cell anemia. Because up to now, we only diagnose it when we have those symptoms. It's the care that you give that will make them become adults. If the care is of substandard, they may not live, but they will not live because they were anemic and you didn't have the blood. They got infections, you didn't have an antibiotic. They got what we call a sequestration and you didn't have blood. They had an aplastic anemia, you didn't have blood to give them. And then as they get bigger, 15, 16, they just need to remember that when you reach there, you're going to move on now. You're no longer a pediatric case, you're now an adult. So that process of transitioning them to send them to the adult doctors, again, we lose them. Why? Two reasons. Because normally when you work somewhere, they may cover your children up to 20 years. Beyond that, they don't cover them. So they will lose a cover and they will be on their own. Kiapili, they also become adults and they no longer want to be told what to do. When you tell him to go and see the doctor, he says, I'm not sick. But remember, because of the chronicity of the condition, you need to be maintained, just to be checked. But they'll tell you, I'm not going. Recently, the World Health Organization recognized that sickle cell anemia is a public health problem, and that's why they passed the 19th of June every year as a World Sickle Cell Day. And recently, again, the World Health Organization realized that this is Africa. This is a big problem for the African continent, and they thought there should be centers of excellence that look after sickle cell patients that are provided for in each and every country in the where sickle cell anemia is a problem. But up to today, how we treated sickle cell anemia in the 70s is still how we treat sickle cell anemia in this 2018. And because of that, we must address this issue as an emergency.